As cases rise above the 6,000 mark again today, questions arise if the increase mean that the country is further away from phase 2 of the National Recovery Plan, which requires daily cases to fall below 4,000. Are daily figures on new infections, active cases and ICU bed occupancies sufficient to gauge the true situation of the pandemic? What are other indicators to look out for in order to reopen the economy? We speak to Public Health Specialist, Assistant Professor Dr. Muhammad Farhan Rusli.
What is the 4,000 based on what matrix, or what is the indicator? Why is it 4,000? So, for example, let's say you test 5,000 people and 4,000 turn out to be positive. All right? So that's the benchmark. That it's 80% of positive cases. But there is a big difference between testing 100,000 and 4,000 being positive. Or even worse, if you test 3,000 people and 3,000 are positive, that's 100% positivity rate. So you cannot look at absolute numbers because it has to be paired with how much testing are you doing every single day. So you have to look at it in terms of rates. What is the percentage of rate that you would like to bring down? So my expectation was that the first phase would be to ensure that the positivity rate of all the cases that are being tested in the country would be trying to bring it below 5%. And then for the next phases, it's 2.5% and below. And for the last phase, is 1% and below. So why do we do this? Because we got to make sure that testing capacity is actually being done. Because for you to reach 4,000, it's so simple, right? You just test half and you will find half the amount of cases. Or you test only a quarter and you'll find quarter of amount of cases. But it does not give you the true definition on what is the current COVID situation. That is why using absolute numbers gives no value at all in you trying to decide.
On Tuesday, Prime Minister Tan Sri Muhyiddin Yassin announced the National Recovery Plan, or NRP, a strategy to transition out of the COVID-19 crisis over 4 phases. The 3 main threshold indicators, he said, are the COVID-19 transmission within the community based on the number of daily cases, the capability of the nation's public health system based on the occupancy of ICU wards at health facilities across the country, and the rate of the population who are fully vaccinated against the virus.